Hi, as you'll know, my name is Nidal Lozada, and I'm going to talk about Parkinson's disease, which is a movement disorder. But first, I want you to hand you this box, and I want you to grab a piece of chocolate with a symptom on it, and pass it around, and each of you can grab a chocolate, and just hold it from me. Okay. In this presentation, I'm going to talk about how your brain controls your movement, the definition of Parkinson's, and treatments. But first, to talk about movement disorder, you have to understand how the brain controls your movement. Your movement is controlled in two ways, the conscious ways and the unconscious. The first one is the conscious. Now, that's controlled by your pyramidal tract. And that works when the cortex of your brain sends a neuron to your spinal cord and tells your body what to do. Some examples is when you punch something, kick something, or you just want to grab something, like you're grabbing that chocolate. The second way is the unconscious one. That's your involuntary movement. It's controlled by your extrapyramidal tracts. And some example of this is your posture, your facial expression, and the movement of your arms when you're walking. And what Parkinson's disease does to the patients is that it affects your extrapyramidal tracts, which affects the daily activities of the patients. We have divided symptoms into two, the motor symptoms and the non-motor symptoms. The motor symptoms are, who here has tremor in their chocolate? Well, you would have a rhythmic shaking, which affects the patient's daily activity so bad. Another symptom is the stiffness of the muscle, and the most common one is bradykinesia, which is the slowness of the movement. Now, those are the common ones. But patients may also have trouble with coordination, balance, and posture. The non-motor symptoms are a sleep problem, constipation, anxiety, fatigue, and a really important one, depression. And you may ask, why is depression so important? Because experiments have shown that if you treat your patient with depression, it will improve their motor symptoms. There's a lot of treatments out there, but none of them really cured the disease. It just helped the patient to live a better life until they die, because it kills the patient. This disease kills the patient really fast. And it's so important to find a cure, because Parkinson's disease is one of the most common neurological diseases in the entire world. And you don't know who's gonna have it. Maybe you, when you get older, might have it, or maybe a family member. Or maybe when in the future, maybe some of you will find a cure and will help millions of lives. Thank you.